Hello, everyone, and welcome back to another episode of the Key Ingredient Podcast. Today, I'm joined by Dr. Brian Wallace, orthopedic surgeon here in Naples, Florida. Dr. Wallace, thanks for joining me today.
Thanks for having me. I appreciate it.
Yeah, we're excited to have you on today because you're the first orthopedic surgeon we've had on the Key Ingredient. So this will be a lot of fun. A lot of people listening have many different issues when it comes to their joints and muscles. And so this will really be great to have you on today. If you don't mind, maybe if you could just tell us just a little bit about yourself, please.
Sure. So I am an orthopedic surgeon. I've been here almost 8 years now. I did most of my medical training up in the Ohio area. I did my residency in the Akron-Canton area and then a fellowship in Cincinnati in sports medicine. So that's sort of a subspecialty area of mine is sports medicine. I'm the team doctor for the Ave Maria Gyrenes athletes, if you guys know that school out east on Immokalee.
Sure.
But I'm a member at the Joint Replacement Institute. I'm a physician there. It's a multi-specialty orthopedic group. We sort of each have our own niches that we do and sort of specialize in trying to take care of our sort of niche areas. That's the gist of it.
Excellent. Well, I'm always curious to see what kind of got someone into their career and profession. So I guess take me back a little bit. Maybe let's go back to high school.
Yeah.
What were you like in high school? Did you always want to be an orthopedic surgeon? And what did things look like for you?
Yeah, I mean, I had a sports injury, pole vaulting in high school, and I hurt my knee and ended up needing arthroscopic knee surgery. So, I had that experience pretty early on, and it really drew me towards medicine and then orthopedics in particular. So I really having that injury and having had surgery, it really sort of pushed me that direction. I always played sports growing up too. So being able to sort of work with athletes, get them back to sports, so weekend warriors and that sort of thing. I think that really pushed me that direction.
Excellent. So in high school, so you knew you wanted to be a physician early on, it sounds like.
Yeah.
Maybe not specifically which one, although it does sound like maybe you had a pretty good idea into what specialty you wanted to go into. What sports did you play?
I ran track, pole vaulted, and I played golf in high school. But I played a lot of other sports younger. I was sort of on the small side. So
okay. So where'd you grow up? Was it in Ohio?
Cleveland. Yeah.
Okay. So you grew up in Cleveland, and then you went on to college where?
So I went to Ohio University.
Okay.
For both undergrad and for medical school in Athens, Ohio. So
what was your major there? Was it biology or chemistry?
It was biology pre-med.
Okay.
Yeah.
Excellent. Okay. So you went through your 4 years there, and along comes medical school. Where'd you end up going?
So the same place, Ohio University.
Okay, well that's good. You stayed in the same place. Yeah. That was nice.
Yeah, that was nice.
Okay, so what happens? Let's talk about the journey after that, because that's when things I think get pretty interesting as far as residencies and different. What was the next stop for you?
So I was sort of stationed in the Dayton area and ended up spending time with the head team physician for the Cincinnati Reds as part of my it's part of my medical school experience. And that really pushed me even further to want to work with athletes at the college and professional level. And then I ended up matching in a residency in the Akron-Canton area, and that's a 5-year program. And then I spent even more time with the Cincinnati Reds doctor, and that's the fellowship that I did. So by that time, he'd started a fellowship, and that was that extra year of training that I did with him in Cincinnati before I started practice.
Okay, so then you went into practice in Ohio as well?
No, I went straight from graduating. I think I graduated on a Friday, and I was seeing patients in Naples on Monday morning.
Were you real? Well, I was going to say, because so much history you have in Ohio, and here you are ending up in Naples. So how did you end up down here?
A really good friend of mine at Ohio University ended up getting an engineering job at the city of Naples. This is back in 2004. So I loved visiting him, especially up north when it was cold in the winters. And my eventual wife, Lisa, and I loved being down here. Ended up matching with my now partner, Dr. Curtis Biggs, who ended up training in the same program I did up in Ohio. So we ended up not training together at that time because we were sort of 10 years apart in the spectrum of training, but we knew a lot of the same people. He was looking for a sports medicine physician as he just primarily does joint replacement. So it was a perfect fit.
So did it have anything to do with the fact that people are so active down here that it just ended up being a great area?
Yeah, I mean, there's a want and need, and I'm sure people know this place has grown exponentially. I mean, I've been coming since 2004, and even just being here for the last 8 years, we've seen an explosion in growth, and people just need good quality care. And it's, as you know, one of the most active places in the country. People are always outside, walking, running, exercising, playing tennis, pickleball, everything. So people want to stay active. They want to stay going and do things they love. So that's what we do.
So you're like a plastic surgeon in Beverly Hills, basically, being down here, right? I mean, that's everybody I know. So I play a little tennis and do my own thing, and everybody I know is always hurt to some degree, including myself. There's always something, and I guess sometimes I envy the people who don't work out, because I say maybe they're in better shape than I am to some degree, because I feel like I'm always hurt. What are some of the more common injuries you see down here in your practice?
I tend to, with my niche, see a lot of shoulder injuries. That seems to be pretty prevalent in my practice. I would say shoulder, knee, and elbow are probably the biggest areas we see. Everything from golf and tennis and those types of injuries to contact injuries, that sort of thing. So
that's what I'm saying. Is a lot of it from tennis and golf? I mean, do you find both, or is it more tennis than the other because a little more active, or?
It just depends. I think there's a ton of golfers in town, so
there are a lot.
Yeah, a ton of golf courses. So I see that a lot. Runs the gamut.
Wow.
And also, I take trauma call at both NCH and Physicians Regional. So I do see some of the higher energy car accidents and more severe injuries too, as well. We take care of those as well.
So what does that look like? What are some of those injuries that you would see?
You see some pretty significant, car accident injuries. A lot of the really, really severe injuries end up going to the trauma center up in Fort Myers. But single extremity, even pretty severe open fractures, we take care of all that sort of stuff down here in Naples. So it runs the gamut. Yeah.
So you do knee replacements as well?
We do. Yeah, we do. My partner and I both do knee replacements. He does primarily hip and knee replacements. Is pretty much all he does at this point.
Okay. So question for you with knee replacements. Mm-hmm. There's a theory. Some people think it's if you need 2 knee replacements, you get them done at one time. Mm-hmm. Some say that's just crazy. You do it one at a time. What are your thoughts on that?
Yeah, I mean, there's pros and cons of sort of what we call staging it, or doing one, waiting a period of time, and doing the other. Doing it bilaterally, you really got to be in good shape, be able to sort of get around and have the pain of both at one time, but you're sort of knocking it out, both at one time. So, there's pros and cons to have that discussion with your physician.
Yeah, I would think you'd be pretty uncomfortable for a while if you do both, but like you said, then you knock it out as well, which is pretty attractive. Yeah. So when you do these surgeries, like a knee replacement, how long does it usually take to even do something like that?
The procedure itself only takes about 45 minutes to an hour. It's pretty quick. We're getting better with the technology, the way we do these, how invasive we need to be to put them in. All of these joint replacements are just getting more and more streamlined. The technology is better. The recovery is faster. It's amazing. And a lot of these we used to do in the hospitals as inpatient, and patients would stay, days and days on end. Now people are going home same day. So we really pushed the same day joint replacements in the right patient, and had some fabulous results.
Wow. I would imagine that there's certain preventive things we could do before, hoping to not have to see you. No offense, but
no question.
What are some of the things? I mean, stretching, obviously, I would imagine is a pretty big one. I mean, what do you normally recommend?
Yeah, I mean, staying strong and keeping flexible really is key. Injury prevention and preventing it before it gets to that point, certainly, paramount. And, with us, we always try everything non-surgical first before we get to that surgical fix. We have injections, physical therapy, anti-inflammatory medication, all these things we try beforehand. We certainly don't always jump to surgery for a lot of these issues people have. So.
Sure. Are there times when someone has something that's bothering them that you would encourage, maybe they don't stretch at that time? Because it could actually probably hurt the situation, right?
Yeah.
Or not necessarily?
Yeah. I mean, it just really depends on the injury, the body part, that sort of thing. But yeah, certainly, trying some, rest ice certainly is a sort of a first line treatment. But, there are some certain red flags for certain body parts where you really need to get an evaluation.
Okay. So what are some of your favorite parts about being a physician? I mean, what do you love most about it?
I love keeping people active and keeping people going, playing sports growing up, being a big sports fan, even if my patient isn't an athlete, I always try to sort of treat them like that. People always tell me, "Will I be able to play golf or tennis after this surgery?" And I said, "That's always my goal, is to get you back to your previous level, keep you going, keeping doing the things you like to do." And that's what's really gratifying about being an orthopedic surgeon, is we actually have fixable problems. A lot of specialties in medicine, you're managing disease. You never make anybody better. You manage it. We could certainly fix a broken bone or replace a joint and essentially cure a person of that issue. And it's really gratifying.
I can see that. So yeah, you have people come in. I mean, they love doing what they were doing. They got hurt doing it, and you're kind of putting them back into doing what they enjoyed the most. I think that's a terrific thing. What do you dislike about what you do, or not like as much?
Yeah, I mean, some of the stuff with insurance is dealing with insurance is getting treatments approved for patients. It's getting more and more frustrating. There's just more and more roadblocks out there for some reason as the insurance companies get richer, and it's frustrating, having to fight and advocate for patients to get what they really need, and having to fight with insurance companies. That's not a fun part of the job for sure.
Yeah, I think the world has changed as well. I mean, even in your profession, I mean, now you're a business owner to some degree as well, right? I mean, you go to medical school to be able to help people and perform surgeries, and you also have to run a business.
Right.
So what's that like? What does your practice look like? How many people are in your practice?
So we have right now we have 5 physicians. We've got a couple more coming down the pipeline, and then we've got another 4 physicians assistants working with us, and then another staff of close to 30 people at this point. So what's nice about our practice is we've got not only physician assistants, but we have our own physical therapy department downstairs. We have an MRI scanner in the building as well. So the goal when you walk through the door at the Joint Replacement Institute is we can take care of you from start to finish. What tests do you need? We'll get an x-ray right there. You'll get an evaluation by a professional, treatment options, and then therapy afterwards. So it's really, you're not going all over town having to do an MRI scan somewhere and then coming back and then going to physical therapy and coming back. Everything is right in house, and that's something we always.
I think people appreciate that. They don't have to go everywhere.
Definitely.
So when people come see you, I mean, the first time they come visit you, it's a consultation. I guess they tell you a little bit about what's bothering them. What happens next? Is an MRI usually the next?
Well, we start with plain film X-rays. Really can rule out a lot of things just based on an X-ray. And then depending on what that shows, what their history and physical exam is like, sometimes we can make the diagnosis and discuss treatment options. If it's more of a soft tissue injury, MRI scan can come into play to get some more information. And then treatment wise, we always try non-surgical things first, and if a patient fails that and we feel surgery is appropriate, that's offered at that point.
Is a PRP? Am I pronouncing that right? Is that a big thing that you do as well?
We're doing a lot of PRP. So that's called platelet-rich plasma. So essentially what we do is we draw a patient's blood and we have a centrifuge. So we spin the blood, the red blood cells fall down, the plasma comes to the top, and that's extracted and injected. There's some early evidence to suggest that it helps with arthritic change, some tendon issues. It's such a new technology. Insurances really aren't paying for it at this point. We see it coming down the pipeline as it becomes more mainstream, and we've got literature to back up that it works. But we've had some really good success with it. Is it being a non-surgical option or an adjunct to a surgery?
I hear about it quite a bit. I know a lot of people do that. So you said there's the plasma. So you separate it, and you actually inject the plasma right back in. Correct?
Exactly.
And what's the medical theory behind that? Why does that potentially work?
So the plasma itself has healing factors and some possibly anti-inflammatory effects. That's the idea behind how we think it works.
And is it more effective by separating? Is that the concept?
Yeah. See, the whole blood that falls down to the bottom of the centrifuge doesn't have the healing factors. It's the plasma that we skim off the top, and that's what's injected.
So you isolate that, and then you get more effect out of that. Interesting.
Exactly.
Now, how much of that do you do in your practice? Is that a popular thing now?
It's getting more and more popular for sure. The fact that it's not covered by insurance can be an issue, and there is a cost to it. But certainly, the way I explain it to my patients is it's a tool in our tool belt. We can't always say that it's 100% going to work, but a lot of times it does, and it saves patients surgeries or as an adjunct to healing for a surgical procedure.
Yeah. How did COVID affect your practice? I mean, so obviously was it March of 2020, everything shut down. I mean, imagine you couldn't see patients. What was that like?
Yeah, it was tough. I mean, for the shutdown period, we were only seeing post-operative patients. We weren't seeing new patients. A lot of our visits were through telehealth, telemedicine, and it certainly affected the medical community from an inpatient standpoint, physicians getting sick, patients getting sick. And we've seen probably a decrease of about 20 to 30% in terms of patient volume. I think still patients are too afraid to get an evaluation by a doctor unless it's really, really severe.
Sure.
So it's been tough. Luckily, we were able to not let anybody go through the whole COVID process. We kept all of our employees, and that was a goal of ours, and we accomplished that.
Yeah, every business owner went through that. Not an easy thing to do.
Right.
So with telehealth, I mean, so what's that like for you? I mean, you have to see people. I mean, it's really you're pretty limited what you could do, I would imagine.
Yeah, it's harder for surgeons because it's better for us to get our hands on you, and that's the best way to evaluate you is by physical exam. Some of the post-operative visits, we can see your range of motion. And we've done some of that telehealth, reviewing MRIs and things like that. But yeah, it's tough to get the whole picture through a telehealth, at least for our certain specialty.
Okay. So on average, how many surgeries do you do a week?
Somewhere around the 10 surgery range per
a lot.
week. Yeah.
So just walk me through a typical day for you.
So Mondays and Wednesdays are my full office days. So I'm seeing new patients, post-operative patients, and follow-ups. And then Tuesdays are my joint replacement days. So I do my shoulder and knee replacements on Tuesdays. Thursday is my outpatient day. So my surgery center. So that's the majority of the cases that I'm doing. So outpatient rotator cuff tears, ACL reconstructions, tennis elbow surgeries, that type of thing, fracture work. And then Friday split between office every other week and surgery every other week. So.
Okay. And then you said you're on call at the hospital as
Yep.
well. How often is that then?
It's usually between 3 and 4 days a month. So it's not extremely often, but a weekend every other month, sort of how we split it up.
Okay. So when you got into this profession, like any physician, you were in the business to help people. I mean, what would you say was different than what you expected? I mean, obviously the insurance is not a fun part, I know you mentioned, but is there anything that kind of wasn't what you would expect it to be when you were kind of going through the process?
I think what's been surprising, sort of in a good way, is the trust that people really put in you to really get them back to doing activities, or in some cases, with infections or bad fractures, to really potentially save their lives. And the trust that they put within you is their well-being in your hands is a great responsibility, but it's so rewarding. It really is.
Yeah. So I'm imagining you love this area. It's just a great place for you to work and build a practice.
Love it. No question.
What as far as medical breakthroughs, I mean, anything you see on the horizon that you think people should know about that could maybe put them at ease, versus surgery or anything else?
I work really closely with Arthrex, which is one of the world's largest orthopedic companies, and working with the development of new technology with them in different facets, and stuff coming down the pipeline is phenomenal. Even within the last 5 years, the way we do most of these routine procedures are getting less and less invasive. Arthroscopy, which is where we make poke holes to look into joints and work with. We've even made the poke holes smaller, working with what we call the Nanoscope. The technology for shoulder replacements is getting less invasive in terms of how much bone we need to take to do replacements. I mean, the technology is amazing. The stuff coming down the pipeline is great. Me being able to see and work with this new technology as it comes out is really exciting.
That is. So how does it work with the Nanoscope? You make like just a little opening?
It's a poke hole. Yeah, it's literally a needle camera.
And then it's a camera goes right in there.
The technology.
How far can you bring the camera down? I mean, how does that?
It's got a working length of centimeter. I mean, you can really do pretty much everything you can with a regular scope. I've done some of these procedures in the office where the patient's sitting there talking to me and performing some relatively major surgeries. It's amazing. That I think is a huge area where we're going to develop. And then sort of we touched on the PRP and stem cells. I think solving potentially arthritis and joint issues with that technology is probably the next major breakthrough.
To go back to stem cell, I mean, that's all I hear these days. I mean, everybody's spending probably billions of dollars on stem cell. Is that, do you see that as the future?
I mean, it's a hot button topic, and you really have got to be careful when a physician mentions stem cells to you. The idea behind stem cells is you're taking an immature cell that can turn into any cell. The problem is, where do you get that from? Is it really a stem cell? I mean, those are the two major issues. Mm-hmm. You can take them from your own body, and where we typically do that is through adipose tissue, which is fat, or from your bone marrow. So harvesting it from yourself and isolating it. That way you really do have true stem cells from your own body. The problem is that patients over 65, their amount of stem cells in their bone marrow or adipose tissue decreases.
So every year it decreases as you hit a certain age? Okay.
So are you harvesting stem cells? Probably. You really have to be careful in the physicians that sell you what we call allograft stem cells. Recently, there's been a change with the FDA that essentially there are no more what we call allograft stem cells available. They pulled them all off the market. So if a physician tells you that they have a stem cell that's not from your own body, that's probably not really true.
Interesting.
So, there's physicians all over the country and world who are selling stem cells as the be all end all, but are you really even getting stem cells? Is it being applied in the correct area? You just really got to be careful. Doing your research, finding the right physician who will talk to you the right way and actually give you the indicated treatment.
You say the right area. Is it like a cortisone shot? Like you really have to find that spot?
Exactly. So
Okay.
all of our injections we do in office, we use an ultrasound. So we really know where any injection we do is going. Some physicians don't. They just blindly inject somewhere. How do you know that it's getting where it needs to be?
Sure.
There's a lot of red flag areas that patients have got to be aware of.
How long does it take for a patient to realize if it worked or not?
Everybody's a little bit different, but what I've seen is it does take a little bit more time with the stem cells as opposed to a cortisone shot or a PRP injection. Typically within a month to 2 months, you'll know.
So can you can use someone else's stem cells? I mean, can that be
We used
done?
to be able to take what we would call umbilical stem cells. So they were, purified from umbilical tissue, stored on dry ice, and we were able to inject that into patients. But again, that live tissue is off the market now.
So that's what okay.
Right. And that's been a recent sort of development in the last month or so.
Wow. Now, the athletes that you work with as well, are there any common injuries with them? Because listen, you and I both know, I mean, following sports for so many years, I mean, everyone's getting more and more athletic. I mean, it's just absolutely amazing what kind of athletes we have today. Are you noticing an increase in injuries? And if so, are there certain ones that are more common than others?
Yeah, actually, during COVID, just with everything going on, we certainly had less sports injuries because the high school and college kids were playing less. But, at Ave Maria, I think 40% of the student body plays a sport. So that's a lot of athletes we see. So, I tend to see a lot of ACL injuries. I do have Thursday, I have a college basketball player with an ACL we're reconstructing. So a lot of ACL injuries in that patient population. That's probably the most common.
Okay, interesting. So for anyone listening right now, we have our audience is very vast, right? We have entrepreneurs, we have young students who want to get into certain professions. Any advice you have for anyone kind of listening and saying, you know what, that sounds like a field I might want to explore a little bit more?
Yeah, I mean, with anything, follow your passion. Once I sort of honed in, and this is what I really wanted to do, I did everything I needed to do. Grades wise, interview wise, test score wise, to get the opportunity to put yourself in the position to succeed. So find a passion, follow it. And if you want it bad enough, you'll get it.
Yeah. Well, it sounds like you wanted very early on, which is same with my profession. So I think that's not that's not rare, not usual, I should say, but it's interesting when you do see something like that. You also something a little bit, and we'll kind of close with this, but something unique as well. You have your pretty big presence on social media. I mean, tell me a little bit about kind of the message you're trying to send.
Yeah. So I have an Instagram and a Facebook page, and I just started a TikTok page. I try to be educational in terms of what are some treatment options for joint pain. I try to throw in some humor every once in a while to sort of humanize the aspect of.
So that for Valentine's Day, I did see that. Yeah.
Yeah. So, we're certainly not stuffy shirted in our practice, and we like to have fun, but, just to give patients a wide variety, peek behind the curtain, what does surgery look like? What does recovery look like? What are some of the new technologies out there? And I've had a lot of great feedback from it.
There are multiple ways, but where can our listeners find you?
So on both Instagram and Facebook, Dr. Brian Wallace is my handle. So it's pretty easy to find.
Excellent. Well, listen, I appreciate you being on the Key Ingredient podcast. It was a lot of fun. And thanks so much for everything you do.
Thanks for having me. Appreciate it. Thanks.